Hello friends. Welcome back to another video tutorial. Today's topic is nanoparticles for the treatment of lung cancer. Basically, lung cancer is one of the most fatal chronic diseases in the field of respiratory medicine. Depending on the kind of malignancy and stage at the time of diagnosis, current lung cancer treatments such as chemotherapy, surgery, segmentectomy, lobectomy, or pneumonectomy, and radiation therapy are used either alone or in conjunction with other therapies. Each of these treatments does have its drawbacks. Conventional chemotherapeutic drugs have a non-specific distribution in the body, where they impact both cancerous and nearby healthy cells. This limits the dose that can be delivered to the tumor cells and leads to treatment that is not as effective as it may be because of excessive toxicities. Additionally, it might take up to 13 to 15 years to get certification for novel drug formulations, and there is no assurance that they will be successful throughout that time. To get over these obstacles, researchers have created a brand new method that selectively targets the delivery of drugs to cancer cells by manipulating cellular processes at the nanoscale. Nanotechnology-based techniques could drastically reduce the number of cells needed to identify the presence of any tumor, compared to conventional therapies, which need hundreds or thousands of cells to do so. This would allow for much earlier detection and treatment regimens. Advantages of nanoparticles in drug delivery system. High selectivity of anti-cancer drugs. Good aqueous solubility of drugs. Types of targeting by nanomaterials. First-generation nano delivery system or passive targeting. Passive targeting takes the benefit of permeability of tumor tissues. Leaky and defective vasculature of fast-growing cancerous tissues can be taken into advantage to achieve passive targeting of chemotherapeutic drugs. This is called as enhanced permeation and retention effect or EPR effect. Active targeting, second-generation nano delivery system. Active targeting is usually achieved by conjugating the nanoparticles to a targeting moiety, thereby allowing the preferential accumulation. Chemotherapeutic drug in the tumor tissue, within individual cancer cells or even within intracellular organelles. The targeting moiety ligand can be antibodies, aptamers, small molecules, folate molecules, and proteins, transferrin. Types of nanoparticles as drug delivery systems. Nanoliposomes. Nanoliposomes are seen to be an almost ideal drug carrier system because their morphology is very similar to that of cellular membranes, high ability to incorporate various substances, ability to increase in vivo drug stability and bioavailability, prevent interactions of the transported drug with unfavorable molecules, thereby reducing toxic side effects, ease of size and surface modification, and biocompatibility and biodegradability. Because of its multiple unique features, nanoliposomes are becoming an increasingly preferred delivery method for anti-cancer medicines. Polymer-based drug carrier. Colloidal solid particles made from biodegradable polymers are known as polymeric nanoparticles, natural or synthetic. They can successfully enter cells through capillaries because to their small size, 50 to 300 nm, which increases the concentration of the therapeutic medication at the site of action. Metal and other nanoparticles such as CNT, nanocage, hydrogel, and micelle are also used for drug delivery applications. Treatment of lung cancer using nanocarriers as pulmonary drug delivery system. Ever since the success of first inhalable insulin, drug delivery via pulmonary route has become an attractive area of interest to treat various chronic diseases. Pulmonary delivery system for nanotechnology is quite an innovative concept, especially when applicable to lung cancer treatment. However, the delivery of inhalable nano-based chemotherapeutics drugs via pulmonary administration for lung cancer treatment is still in its very early stage and numerous challenges are expected. The bioavailability of drugs in lungs could be increased using pulmonary administration as lung possesses limited number of intracellular and extracellular drug metabolizing enzyme activity unlike gastrointestinal tract and liver. Larger surface area of lungs provide higher absorption rate, rapid onset of action and reduced drug doses. Nanotechnology-based carriers through the inhalational route of administration is worthy in SA novel upcoming targeted drug delivery in inhalational nanomedicine. It offers an effective and safer mean of lung cancer treatment.